I'm Bobbi Fischer, and this is my Aesthetically Awkward Podcast, a show where we dive into all things aesthetics, health, wellness, entrepreneurship, and everything in between. This podcast is for informational and entertainment purposes only. It is not medical advice. Please consult your own healthcare provider before making any decisions in your personal health journey. Now let's get into it. Welcome back to another episode. Today I'm joined by Isabelle Snapp. She is an aesthetic registered nurse here at Luxe Lift, our clinic in Danville, Illinois. She joined us June 2025. She started as an aesthetic nurse apprentice. She was supposed to do her apprenticeship for 6 months, but she actually completed that about a month early. So she finished in November. She comes to aesthetics with a strong background in critical care nursing, having worked at a level 1 trauma center. She continues to work part-time in an outpatient post-anesthesia care unit. She holds a bachelor's of science in nursing, along with several advanced certifications in nursing, and she's currently continuing her education, getting her master's degree with a goal of becoming a nurse practitioner. So today is an intro to those of you who have not had a chance to meet her in clinic, or for those of you who listen to us from afar. Welcome, Isabelle.
Hello, everyone. I'm so happy to be here and kind of share my story and my journey that I've been on for quite a few years now. I am fairly young. I will tell you how old I am. I'm almost 24. I'll be 24 next month. But I've been in healthcare for a long time. I started in healthcare at a really young age, and it matured me really quick, but I feel like I'm very happy with how far I've come, and I've been doing this for a while, so I'm excited to share my story.
You are young, but you already have several years of experience. Critical care was something, when I posted that job for the apprenticeship, I specifically was looking for another critical care nurse. Those skills are phenomenal in an outpatient clinic because sometimes we get complacent thinking things are never going to go wrong. So I wanted to make sure whoever was joining me had that knowledge and that experience. So when things inevitably hit the fan, you're able to hop into action. So you've been an amazing addition to our team. Our patients and your coworkers all adore you. So we are going to get into the background of who is Isabelle. But before we do that, we are going to start with the behind the mic segment. For those of you who have listened to episodes in the past, this is where we share one flex or one flop, something recent over the last week or so, something that went well, or maybe something that went sideways that helped teach us a lesson. So it doesn't have to be work related. Isabelle, I'll let you choose. Do you have a flex or a flop to share with us today?
I guess I'll go with a flex. So I just last week started my first week of nurse practitioner school. So it's getting into full swing now, but I'm very excited.
It's going to be a lot. Are you full-time or are you part-time in your program?
I'm kind of in the middle. Full-time is considered 4 classes. Part-time is considered 2 a semester. I'm doing 3. Okay. So I'm right in the middle.
Okay. I like that, kind of finding that sweet spot. So tell us where you're doing your program, what the structure is like, what we can expect your schedule to be like over these next couple of years while you complete that.
So I started at University of Southern Indiana. It's in Evansville, Indiana. It's didactic loaded. So the first 2 semesters are strictly didactic classes. And then after that, I go to a full year of just clinicals. So I will complete 6 classes up front, didactic. And then after that, I will go into my clinical rotations starting in the fall. So my schedule won't really change until the fall. That's where it's going to be a little up in the air. I have kind of planned for that. I might have to cut my hours down in my post-anesthesia care unit. I'm willing to do that because I'm really wanting to prioritize my education and furthering my career. I've always loved school, but starting clinical rotations in the fall is what I'm really excited for because I get to pick where I want to go. So obviously I'm going to go back to my tried and true. I'm going to go back to the critical care unit. I'm hoping to do a trauma rotation with our trauma team, and then I'm really looking into neurosurgery rotation as well, just to get that experience. And then if I'm able to, I want to do an aesthetics rotation as well here to kind of see how things go on the nurse practitioner side versus the nurse's side. Because when I graduate, I want to do a little bit of everything like I have been. I love, kind of split it up, getting experience in different locations and just really becoming a well-rounded nurse because I feel like every place I've been, I've picked up different things that I'm so thankful for.
And your assessment skills working in the critical care, especially in neuro, are going to be a huge asset to us here. So I love that. And you are doing adult gero nurse practitioner, correct?
So adult gero, acute care nurse practitioner.
So those are the same credentials that I have. Welcome to the club. Love that for you.
I was debating between that and family nurse practitioner. I work with kids now in outpatient surgery, but I love kids, but in a medical sense, they're not my favorite.
100%. No, I never want to work with sick children. I love happy, healthy children.
Yes.
I don't have the heart to take care of sick children.
Yes.
I would never be able to maintain my composure in that setting. It's just not for me. kudos to everybody who works in pediatrics, especially like ped onc or ICU. It's phenomenal. You have to really have a strong personality and be able to meet the patients and the families where they're at. I could not. I would fall apart emotionally. So again, props to you. Working in an adult ICU, I was always able to maintain my composure with that. You'd have the days where you take things home with you and cry, obviously. Like you would have those really strong emotional, tormenting situations, but I couldn't do it with pediatrics. So
Yeah, I feel like a lot of times with pediatrics, it's not the kid's fault, you know, and with adults, we make bad decisions and sometimes things happen that is kind of our fault. So it's a little hard to rationalize kids because they're just so innocent. My best friend, she works at Riley Children's Hospital in Indianapolis. She works in a pulmonary step down, and she tells me some of the saddest stories. And I don't know if my heart could take it.
Yeah. I mean, it's hard enough when you've got, an adult patient who's a victim of abuse or domestic violence, but when it's a child, just, I can't do it.
Yeah.
I can't do it. I can't work in a setting anymore that makes me sad. So I love aesthetics for a reason. My patients are happy and, for the most part, healthy, or we're helping them achieve their optimal health. I love that. So
yeah, and that's a big difference coming from the ICU is where this is the worst day of this person's life
exactly.
versus coming here and it's like, oh, I'm just helping you feel more confident.
Exactly.
I love that.
Exactly.
But I love them both. It's just, it's so different.
Well, and definitely for as long as you can, if you can maintain both, I highly encourage that. And of course, we're going to flex around your schedule to make sure we get you to clinicals. The good thing about doing the ACNP program versus FNP is not all, but most FNP programs, if you're going to get placed at a clinical site, it's going to be like Monday through Friday, 8 to 5. And if you're doing ACNP, at least if you do it like me and you're crazy, I did 12-hour shifts on overnights in the ICU to get all my clinical hours knocked out. So I was able to keep working through the day during the week. And then, I just sacrificed my weekend hours to get my clinicals knocked out quickly. Yeah. So especially if you're doing ICU, maybe you're going to be able to do something like that. Not for all of your clinical hours, but for a chunk of them.
Yeah, especially in inpatient because, there's a neurosurgeon APRN that work nights, and there's trauma APRNs that are on overnights. So even if I have to do overnights again, which I love my day shift schedule, but if I have to come back to overnights,
it won't be temporary. It's going to be for like 6 to 12 months, and it's only going to be a couple days a week or every other week. So it is going to be a short-term inconvenience for the long-term in-game payout. So it'll be worth it.
Another reason I chose acute care for family is because I did like being in the hospital. I liked the patients that were acutely sick, and I didn't want to tie myself to a clinic necessarily. I feel like it has a little bit more flexibility. Nursing has flexibility no matter what route you go.
Oh, absolutely. Sky's the limit.
Yes, I absolutely love that. But I just felt like acute care was more my preference with strictly adults and flexibility in and outpatient.
Absolutely. Well, let's go ahead and back up a little bit. I want people to learn about your background, who you are as a person, because a lot of people have been introduced to you in little bits and pieces, bite-sized segments, either on our social medias, Facebook, Instagram, TikTok. Maybe they follow your personal or professional accounts or our clinic accounts. Maybe they've read your bio on our booking site or our website, but that's really only a snapshot, a little snippet of who you are. So let's talk about who you are, where you came from, your origin story. Tell us about your childhood, where you went to school, all about your family, all the things.
Okay, so I was born and raised. I always say Georgetown, Illinois, but it's this little tiny town south of Georgetown. It's called Olivet. I was born and raised in Olivet, Illinois.
So you're local to Vermilion County.
Yes.
Yep.
I currently live outside of Oakwood, though, so I have that happy medium between Danville and Champaign, which is nice. But I was born. I'm the youngest of 8, so I have 7 older siblings. There are 5 girls and 3 boys in my family. And it was pretty hectic growing up. I was the youngest, though. So
I'm imagining the Brady Bunch house.
Yes, exactly. It was pretty crazy. Like, my oldest sister, I always just say she was like my second mom, essentially, because she was the oldest of all of us. So we started with a girl and then with a girl.
She was probably a huge asset to your mom, helping corral all the little ones.
She would take me to school in the morning. She was just like my second mom. But it was always crazy growing up. Obviously, money was tight, but I still have, a great childhood. I still have, a ton of awesome memories. I grew up on a farm. We always had mostly, chickens. We had some pigs, goats. I loved our goats. We had goats growing up that we would pet, and they didn't really do much. We didn't get milk or anything from them, so eventually we got rid of them when I was really
more like
sad.
A hobby farm.
Yeah.
And so you weren't doing 4-H or anything of that nature?
Nope. And now my parents, out on their land, they have they still have cows, and they have goats out there on their land, and then my my neighbor actually rents land from my parents, and he has buffalo and bison out there. So
wow. Okay.
still kind of cool to go out there
Is
and
it
see.
still hobby farm, or do they raise for meat?
Some, like we have a miniature Highland that's like a pet, and then we have some that are for meat. Yeah. We have some that are for meat and some that are pets. But grew up on a farm and went to Georgetown School District. I went there my entire life. I never moved. So when I got into high school, I don't have like an origin story where like, I know I want to be a nurse because of this. My grandma was a nurse, and then I have one older sister that's a nurse. But I don't want to say that they didn't really influence me. It's just I always grew up being a very caring person. Like my mom always tells these stories of when I was like a little kid. I was like 3. I'd get up and put my robe on. I always like to sing and walk around the house. And I would start coffee. I didn't drink coffee, but I would start coffee, and I would just start the pot of coffee for her, and I would sweep the floors. My mom would get up and I'd be like, I swept the floors and started coffee. Like I've always just been a caring person. Like I've always just done stuff for other people. And I just kind of like, healthcare was just always in my mind. Like when people asked me what I wanted to be when I grew up, I wanted to be a nurse. I was a nurse for Halloween. And I kind of went back and forth. Do I want to be a nurse, PA? Because as you get older, you learn about all these different things.
Sure.
When you're a kid, it's just nurse or doctor, And as you get older, you realize there's all these different routes. So when I was about 15, I was in high school as a sophomore. I decided I wanted to take a certified nursing assistant class. It was paid for through Georgetown High School.
What an amazing opportunity.
I know. I think it's called College Express is what it was called when I was there. I don't know if it's still called that, but I would leave the high school halfway through the day and go take this CNA class. And it was a pretty tough class. Like my instructor was really awesome, but she was kind of tough on us, which I'm happy about.
She wanted to make sure she was grooming good CNAs, which we need.
Yeah, she really made my foundation for nursing awesome, which I'm so thankful. Like med term, like my CNA class was a whole year. It was 2 semesters, so it was real in depth.
So it wasn't like the quick, was it like 6 or 12 week CNA courses that you could do through the community college? This was much more foundational then,
and I am happy about it. It was paid for by the school, and it really set a foundation for med term, just like care in general, vital signs. I remember I had to take a manual blood pressure on every single person in my class.
So you really had to learn those foundational skills, not just relying on electronics. So did you get like course credit? Was it for college credit, or was it towards your high school diploma?
It was for college credit.
Nice.
And then I also, it was to both. It was dual credit.
Because you did the dual enrollment program at DAC, right?
So after I finished my CNA class, that summer I started dual enrollment. So there's College Express, which is paid for by the school, and then dual enrollment, which is not. So then I started dual enrollment, which is where all summer in between my junior and senior year, I think I took 3 summer classes. I did take 3 summer classes, and it was the first ever time taking online classes ever in my life. I decided I was going to take 3 of them in a summer period. So
look at you giving up the most iconic summer of your life between junior and senior year, where everybody else is like having a great time, partying, all the things, and you're going to class full time.
Yeah,
oh my gosh,
it was.
Good for you though.
It was half off because it was half off, so I was trying to squeeze as much as I could.
Can't pass up on a good deal.
To get the good deal.
Especially on education. I mean, look at if you were making such good decisions at such a young age. I love that.
I'm thankful for that.
Absolutely. You had a good head on your shoulders from the start.
So I took 3 summer classes, and then I kept taking classes. When I started my senior year, I would take 2 or 3 classes at the high school, leave, and take 2 or 3 classes at DAC, which was nice. I would actually leave halfway through the school day. I'd drive myself up to DAC, and I would go in the classes. The teachers did not know I was in high school. I was treated like a regular college student. I had the same expectations as college students. I had to be there every day. But I took my anatomy, my phys, my microbiology, all of that while I was in high school at DAC for dual credit. So I was able to complete all my nursing prereqs before I'd even graduated high school, which was nice.
That's amazing.
So my senior year, towards the end of my senior year, I applied for the DAC nursing program, and I had gotten valedictorian. I was valedictorian for 2020 for Georgetown right from high school. So I got 2 years free. So I'd already completed my prereqs and paid for those. So then I graduated, I got 2 years free, and I'd already applied to nursing program, got in. First year was LPN year, second year was RN.
And you tested out and went ahead and got your LPN, right?
So after the first year, it was all paid for. So after the first year, I was working as a CNA at this time. I was working at least 2 times 3 days a week to help pay for my school, because while I was in high school, I was taking classes while also working to pay for the classes.
Paying as you go, not trying to accrue a bunch of student loan debt.
Yes.
Just being smart from the start.
And I knew, there was a lot of us kids. I knew my parents weren't going to be able to provide money for education,
Yeah,
which is
resources
fine.
are thin when you've got 8 kids.
Yeah, so
I
I
understand.
knew it was on me, so that's why I was trying to get the deal, pay it off as I go, and I was able to do that pretty well. But after that first year, I'd worked as a CNA for almost 3 years at that point. I had tested out for my LPN and then was able to start working. I worked in long-term care as a CNA, so I was able to stay in long-term care but work as an LPN. And some of my classmates debated on doing this. For anybody who's out there that's debating on doing this, if you have the opportunity, I would, because I was able, in long-term care, a lot of elderly people are on a lot of medications.
Yes.
I was able to learn so much about these medications because I was giving them every day. I was able to get experience cleaning and changing out trachs. I was getting experience with tube feeds. I was getting experience with giving insulin injections, antibiotic injections, because even though it was long-term care, we still did skilled nursing. So there was a lot of skills that I, like exchanging Foley catheters. I had to do that a lot because people with chronic Foleys need them exchanged. I think it was every 30 days. I don't know if that's changed, but that's what it was.
It's been a while, but that used to be the regulation. I'm assuming it's still the same.
So I got those skills under my belt while I was still in school, so that I was still going from long-term care to the ICU. I still felt like I was thrown to the wolves, but I had a little bit of something under my belt to go into it.
Yeah, it's a totally different environment, but really it is a great foundation. Like you said, you're learning how to do all of those ADLs. So you had the CNA work to help people with their ambulation, their toileting, and then you got the LPN experience to help with med passes. You were learning more about like all these different drug classes and the adverse events and the expected side effects. So you were getting all that foundational knowledge that helped shaped you into a critical care nurse.
And I had to call providers. I had emergencies where I had to call and talk to EMS. Like, it really, it helped mature me. Going from a CNA to an LPN, I remember I was the one that people were coming to with problems, and I had to figure out how to solve them. Because in long-term care, you might have 2 nurses in that building.
Yeah.
So it really brought a lot of autonomy, but also kind of helped build my confidence too.
And I see so much shade thrown at like the 2-year ADN programs, but honestly, I was a DAC graduate too. Danville Area Community College, for those of you who are not local to Vermilion County, the nursing program is an associate's degree in nursing. It's a great foundational opportunity. There are so many people who will say negative things about an associate's degree, but honestly, it was a phenomenal foundation for me and for so many other people, especially if you're coming in with CNA experience, especially if you take the opportunity to sit for your NCLEX, for your LPN boards. It's going to help prepare you for your RN NCLEX. Then you get that ADN, you work as an RN while you're getting your bachelor's degree, which is what you did, right? You worked in the critical care while you were getting your bachelor's degree. So tell us about that experience.
So after I graduated with my ADN, I knew I loved long-term care, but I knew that wasn't where I wanted to end up. I was like, when I went into nursing, I thought of nursing as the ICU.
Okay.
I thought of, I'm going to be running around, I'm going to be doing all these crazy things. So that's ultimately what I wanted to do. So before I'd even graduate nursing school, I applied to the CCU, the critical care unit, in February, had gotten acceptance in March.
Okay.
So I hadn't even graduated school when I knew I was going to start there, which was kind of nice because then I was able to prepare myself before it actually started. And the ICU was able to prepare and like review, like, watch YouTube videos about different drips and drugs and everything, because I not that I felt underprepared, but I wanted to brush up. I do feel like DAC is a really good nursing program. I went through it, and just our first semester, half of our class failed. It went from 32 to 16 just from the first semester. Like, it is tough.
It is tough.
And I also did it it was the beginning of COVID. So it was halfway online. So that also made it way more difficult.
Yeah, I was going to say, for some people, they just cannot learn in that virtual realm. It's just impossible. They need that in person. And everybody's learning styles are different. Again, I'm not trying to hate on anybody who can't, but unfortunately, those were the cards.
And it was so new
that were dealt.
Too.
Yeah.
Yeah, it was so new to everybody. Even the teachers, the instructors had never even taught online, and they'd been teaching for how many years?
Yeah, I'm sure the instructors were also panicked too, because it's one thing to have like a portion of your course that's virtual, but most nursing programs are hybrid at this point, but before that, not a lot was. You would have Blackboard or Canvas, etc., with some things that you didn't necessarily need to meet in person for, but to try to do like the simulation labs and everything in a virtual setting is a lot. So you worked full time in the ICU while completing your bachelor's degree?
Yeah, so I started in the ICU. I was full time. I started in June of 2022. So I graduated with my RN in May of 2022. I started in the ICU in June. of 2022, and I did feel a little thrown into the wolves, but there was just so much. I learned more than I could have ever imagined. I learned about more modalities, therapies than I ever could have imagined there were.
Okay.
Especially like like in school, they mention things, but when you actually see it, it's like completely different. But I worked full time in the ICU. I started my bachelor's program in October of 2022, so I gave myself a little break there from school just to kind of help, because I was starting in ICU. And when I started there as a new grad, there was like an ICU class I had to take. I just wanted to give myself time to actually get into my new role in my career before taking on additional schooling.
Oh,
So
man. Yeah, I get that. It's a lot. You need a little bit of a break. So did you do an actual ICU residency program?
yeah, it was the certified nurse residency program. Technically a 6 months residency, and I had about a 5 to 6 month orientation in the ICU, which
Okay.
was nice.
And I did a similar program. Again, it's been over a decade since I did that, but it is phenomenal because you have a mix of working on the floor, getting those real life experiences, but you also have that dedicated time to coursework to help you learn more about those more advanced protocols, the devices, the procedures, the drips, all the
Yeah.
things. You ended up doing like a distance program, right? Or did you have to relocate for your bachelor's degree?
So my bachelor's degree, I went through Eastern Illinois University. It's in Charleston, Illinois, and I currently was working in Champaign, Illinois. So they're about an hour away from each other.
Okay.
Their bachelor's program is mostly online, but I had a couple prereqs. I had to take speech, and I needed another credit in something else. And I took women's health, which was in person as well. So I had to move down to Charleston. I lived there for about 9 months. I lived in Charleston, Illinois, and I would just commute that hour to work. But when I was living in Georgetown, it was about an hour to work anyway. So the commute wasn't really different.
Okay.
But it was mostly online, a couple in-person classes, but I did live pretty close to campus, which was convenient for like picking up books. If I had any issues, I could go to instructors like office hours and stuff, which was really helpful. But I definitely, if I did not have to take those in-person classes, you definitely could do it from remotely.
So you're coming up on the 4-year anniversary of graduating nursing school, but I know that you've shared with me privately a huge event that happened just a couple months before you graduated, something that kind of shaped you, gave you real world experience that you weren't expecting. Do you mind sharing that experience with our listeners?
Yes. So March 6th, 2022, I know the exact day. That day I had been in Bloomington, Illinois at a hockey game for my nephew. And then that evening I went home. It was a Sunday night. I had a test the next day. So I had this little room in my house that I made my little office for school. So I was in my office is what I called it. And I was on FaceTime with 2 of my classmates and we were studying. And my mom had been texting me, but I was studying, so I wasn't really answering. And my mom, I love her to death. I love you, Mom, but she is very dramatic, okay? I love her so much, but that makes a big difference in this story. So I was in there studying, and my mom kind of been texting me, but I wasn't really looking at it because I was on my computer. And then she came in to the room that I was in, and she was like, "Hey, I need your help. I need you to come right now." And I was like, okay. So I'm like, hold on. I'm talking to my friend. I'm like, I'll be right back. Hold on. Sorry. Ugh, like not thinking it was a big deal. I'm like, geez, Mom. So I walk into my parents' bedroom. I follow her through the house to my parents' bedroom. And my dad is face down on the floor.
Oh, gosh.
Yeah. And I remember I ran up to him. I was like, Dad. And I picked up his hand and it was completely blue. And that was like the first thing I was like, and I was an LPN at this time, but I had never ever done CPR. I had never had a situation like this. So, and it's just me and my mom. My mom has no medical knowledge. She's not in the best health. She's pretty weak. She was help, but she wasn't going to be much help. And I knew that. And she has no like medical background.
Sure.
So I knew it was a lot for her, but it was a lot for me, but it almost was more a lot for her, I felt.
Well, sure, that's her spouse down, has no idea what to do to help him. Yeah.
So she came and got me, which was good. And as soon as I saw that his hand was blue, I said, call 911. And she said, really? Yes, really. No, I'm just kidding. But she's like, really? I'm like, yes. And at that point I was feeling, well, she was calling 911. I was feeling for a pulse. I remember first I was feeling for a radial pulse. And I was like, oh, like, I just don't know what I'm doing, because I didn't want to admit that my dad didn't have a pulse. So I was sitting there and I was like, oh, I'm just not feeling the right spot. So then I went up to the neck and I'm like, oh. And then eventually it got to the point where I was like, all right, like, you have to accept reality.
We got to do compression.
As much as you don't want to do this, you have to.
Yes.
And I was really into lifting weights at that time, thank goodness. But my dad, like a week prior, had told me that I needed to stop lifting weights because my legs were getting too big. But at this point in time, I think he'd be thankful that I was lifting weights because he was face down and I had to do chest compressions.
Dad, you need to be happy that she was in her bulking phase.
Yes. So I had to flip him over. My mom kind of helped me, but I flipped him over and I started doing CPR on him. And he was doing like the snoring, like the agonal gasps.
Yeah.
And I didn't know what that was at the time. I remember later on learning about agonal gasp and recognizing that's what that was. But he almost sounded like he was snoring, and my mom told the EMS people that, and they were like, that's a bad sign. You need to do CPR. But at that point, I was already doing CPR, and I remember feeling his ribs crush underneath my hands. I remember I was doing CPR for a long, it felt like forever, probably like 5 to 7 minutes, because my parents, like I said, we live outside of town.
Goodness.
And it was like with every compression, I could just feel him moving underneath my hands. And he'd recently eaten dinner. So I was like, maybe he choked or something. Because he I don't know, he had eaten seafood. I hate seafood. I could just smell it, So I remember I turned him on his side a little bit and I kind of put my finger in his mouth and tried to see if I could feel anything.
Do a finger sweep.
Yeah. And
sure.
I didn't see anything, didn't feel anything. So I was doing compressions and I know they don't really train you in rescue breaths anymore, but it was my dad. I was doing mouth to mouth on him. I did rescue breaths on him. But I did CPR for a while. And then before the ambulance got there, a cop showed up and he took over compressions for me.
You were probably exhausted at that point. Do you know how many minutes you had done CPR?
I think it was like I was usually 5 to 7. I think it was like 6-ish.
And usually we cycle off of after at least 2, like at max 2 rounds in the hospital setting, in the acute care setting, so we don't exhaust ourselves. So she had already done 3+ rounds on her own before she had backup there on her father, no less. So.
Yes. And I just remember like, it didn't even look like him. Like he was so pale and blue. I remember just like holding him in my arms. And I remember thinking like, my dad is dead in my arms right now. Like, my dad's going to die tonight. Like, I literally thought that, like, my dad's going to die tonight. I have a test tomorrow. Like, I'm so bad.
You had so much going on for a 20-year-old, and this was your first experience. So tell us what was the outcome? How is Daddy Snapp?
So he is doing great now. He's alive and well. Yes, he's got to walk my sister down the aisle and see his grandchildren, grow up and everything. So he is alive and well.
You gave him a second chance.
But cop came, took over, EMS came. Eventually, we got him out the door. And I remember before the ambulance left, they said, we got a pulse back. And I was like, okay, well, that's good at least, And he went to the hospital. He was obviously hospitalized for a little while, and a lot of appointments and tests were run after that. But he is doing good now. He is pretty much back to normal. I remember, you always had that scary part where like, are they, is their brain going to be affected? Are they not going to be the same? Are they going to be disabled? There's so many questions up in the air that you don't know right away. But I'm lucky that he's been able to pretty much go back to his baseline. So
had you not intervened so quickly, had you not been home, had anything else changed that day, he wouldn't have had that outcome.
Had I chose accounting.
Yeah, exactly. That was the first real world experience that you had. You had to navigate it by yourself with no backup, and you crushed it, and you saved your dad's life.
Yes.
So.
I remember he was like, I had 7 broken ribs. He did have 7 broken ribs.
Oh, well.
That was my fault, but he's alive. And
a broken rib or a casket. I mean, if you have to make the choice, I mean, I know it wasn't a fun rehab for sure. I definitely don't envy being in that position for either of you, but I'm so glad he's still with you.
Yeah, and he always like said like, the nursing gods tested you and you passed. That's what he always said to me afterwards. And then when I had to move to Charleston, I was almost hesitant to move away because I was like, if I wasn't there, because 3 months later I moved to Charleston. So I was like, I almost felt like bad for moving away just because if I had been gone.
Like you wanted to be your father's keeper.
Yeah.
You wanted to look over him.
Because when he was in the hospital, he didn't want me to leave. He kept saying, I just feel better when you leave.
Yeah, you're his guardian angel at that point. I'm sure he did. He probably just wanted to stuff you like Velcro.
I felt bad leaving. And
I get that. But I'm sure you talk to him all the time.
Yeah.
Text you and all the things. So, and you guys, you have a really close family, right? Like you see each other regularly. I mean,
out of all 8 of us, 6 of us live in the county.
Okay.
So
big family gatherings. I'm sure Christmas, Thanksgiving,
every holiday
birthdays,
bombarded.
All the things.
We're almost outgrowing these houses.
So we've talked about your academic life, your professional life. Let's talk about who you are outside of work, outside of school. What's life look for you outside of Luxe Lift?
Outside of Luxe Lift, I have a boyfriend that I've been with for a couple of years now. We live together outside of Oakwood, which I mentioned earlier. We have 2 puppy dogs and a cat. So we have a 3-year-old English Staffy. She's a little pit bull. She's the best. Her name's Ella. I rescued her when she was a year old. I rescued her when I lived in Charleston, actually.
I love that.
And I would walk her around campus to socialize her and stuff. So she's my little bestie because, I went through a lot with her.
Sure.
And then last year for Christmas, my boyfriend got me a mini dachshund, a mini weenie. And his name is Rio, but we pretty much just call him Weenie. And so he's a little over a year old now, and he's super crazy. And I just love him. He's my little baby boy.
I love little feisty dogs.
And between him and Ella, I got her when she was a year old, and we had, that connection where we only had each other for a while. But with him, I actually got to see him as a puppy and grow up.
There's a difference.
Yeah.
I mean, I love adopting an older dog, but being able to connect during the puppy stage and then survive it, like all the chewing and the biting and then, all the house training them, all the things, it does help you create a really deep bond.
Yeah,
so I love that you have
she's
both.
my bestie, and then he's my little baby.
Yeah. Yeah. Well, she's been like your emotional support dog.
Yes, she was there through a lot of stuff.
Absolutely.
And then I have a cat. His name is Phil. So when I bought my house outside of Oakwood, he just, when I lived there for 6 months, he just showed up and he wouldn't leave. So eventually he's just like an indoor-outdoor cat. I thought he's a big fluffy orange cat. He's huge. And I remember thinking it was a girl, so I named her Fiona.
Aww.
And then I took him to the vet, and they're like, it's a boy. I'm like, okay, well, Phil.
Was it Fiona after Shrek?
Yeah. The redheaded cat named Fiona. I thought it was so cute.
That is cute.
So now he's Phil.
And then the dog named Rio, is that after the movie?
Yes.
Okay.
Yeah.
Gotcha.
The bird.
All right. That's adorable. All right. And then we did kind of, I guess, skim over your transition into aesthetics. I did forget to ask about that. So tell people about the first time that you met me and you were introduced to Luxe Lift. It is a good one.
So the first time I met Bobbi, I was 19 years old and I really wanted lip filler and maybe a little Botox on my forehead. So me and my sister, who's 2 years older than me, she was 21 at the time, I was 19. We made an appointment and we show up and I'm like, hey, Bobbi, I would love lip filler. And she told me no.
So remember, Isabelle turns 24 next month. So 5 years ago, she walked into my practice asking for lip filler. And I looked at her and she's this perfect, adorable model-like specimen. And I'm like, absolutely not. Get out of here. Get yourself some lip plumper and go back to
She was
school.
very nice about it.
I was too, but I'm like, absolutely not. So maybe a lip flip. But so fast forward 5 years later, I guess technically 4 because it was last summer, she saw the post for our aesthetic nurse apprentice. What made you decide to put in for it?
Well, I've been following you for a long time. I met you guys when you guys were in the old building. I had watched the practice grow, even though I wasn't, necessarily old enough to get treatment that time. I still had followed you and watched everything grow. And I remember seeing the listing and I was like, I need all these qualifications. And I was like, I would absolutely love to do this. And I've been interested. Obviously I've been interested in this for a long time. So I put in my application and I was really excited, but I always tried not to get my hopes up because I knew it's kind of hard. I feel like a lot of nurses want a position in aesthetics and it's hard to get your foot in the door. It's hard to find not only somewhere to work, but somewhere that's willing to train you, put in the work to, me and Bobbi one-on-one trained for months. And it's hard to find. I didn't want to feel like I was thrown into the wolves. I didn't want to put needles in people's faces not knowing what I'm doing.
Sure.
So that's why when I saw that it was here and I saw it as an apprenticeship program, I was like, this is absolutely perfect. So I got my resume together and stuff and I submitted it. And it took a little bit, and I got an email for an interview. And I remember I put on my little blazer, and I came in.
You were so professional and polished.
I really wanted the job.
And you are right. There are a lot of people who, we have people reach out to us constantly. But when we posted that, I think I had to sift through about 30 candidates. So we had around 30 resumes that were submitted. I chose the top 10 that we extended interviews to. And I think we ended up interviewing 8 altogether. And it was, I've decided to be very intentional hiring. Not that I've made a lot of hires because we just really started hiring over the last 2 years, but I've decided to be pretty intentional with the hiring process, slow to hire to make sure we find the right fit. And then we did a second interview too. So you came in, you met the whole team for the panel interview. We took turn. We did a round table, asked you questions.
Yeah.
How was that process for you?
I had walked in and I didn't know what to expect because I'd had a couple interviews, but especially going to nursing school and COVID, a lot of them were online.
Sure.
So I remember I walked in and it was a white table and it was 5 people around it that I didn't know. And I was like, this is going to be...
You've seen us on social media.
Yeah. So I sat down at the table. And everybody introduced themselves. They were really nice. And they just took turns asking me different questions. And obviously I didn't know the questions beforehand. So I just answered with genuine answers. And obviously you guys liked that. And I was invited back for a second interview and a shadow. And this is when I was like, all right, I'm getting to the final top. So I came in, and when I was shadowing, I tried to be as hands-on as possible without crossing boundaries, if that makes sense. Like, oh, I'll throw that away, or I didn't want to cross boundaries, but I wanted to show that I am eager to learn. I'm eager to get my hands on things. I was dying to just try something out. And that's something that I'm really thankful that I've been, because when I was in LPN, I remember I was really scared to like draw blood and do all this stuff. And then, so I kind of was hesitant to do things. And then I remember, oh, now I'm on my own and I have to do it. I should have done it when someone was right next to me.
Exactly.
So I took that into my ICU career and my career now, with if opportunity arises, you take it.
I'm a big proponent of the see one, feel one, do one. So watch somebody else do it, get the procedure done yourself if appropriate, and then you need to perform with supervision. After you've done that, once you're comfortable, then you can move on to doing it without supervision. But that's kind of what we did like throughout your aesthetic nurse apprenticeship. So yeah, we did that panel interview, which you crushed. You got the highest scores out of everyone. We did some secondary interviews with a couple candidates. You came in and shadowed with me on a Saturday, and you were there with bells on early. You were ready to rock and roll. You followed me around. I remember you holding the chiller while I think it was like a Pixelate RF laser. So you were super into that. And I knew after that shadow, like you were definitely the nurse that I wanted to pick for the position. So you've been a great asset to the team. The entire nurse apprenticeship, you were very attentive, taking notes. You were making little educational TikToks of all the things that you had learned. What is your favorite thing about working in aesthetics?
Obviously the injectables. I love talks, but I hate that it takes 2 weeks to see the results.
Yeah.
I want to see it right before you leave.
Yep.
That's why I love filler. Filler's a little more nerve-wracking for me, but I'm getting I love it and I'm getting so much more comfortable with it. But I love the instant results of filler. But I also love a pico laser.
Oh my goodness. Yeah, I know. I guess I need to. What's your favorite injectable?
Yeah.
What's your favorite energy-based device? Because yeah, it is. Yeah, it's hard for me too. Because
I've had the pico laser done. I've had a pico laser facial treatment done, and I'm in the process of getting tattoo removed with the pico lasers. There's just so much you can do with the pico laser. It's one of my favorites. I like it's just so versatile, but also anybody can benefit from it, and it's just awesome. It does so many different things. Like, I just noticed we did my pico laser in September, and it was like every little freckle I'd had was basically gone afterwards. It was it blew my mind. And I love seeing the results from it.
The technology is awesome. I love that. Like you said, it's versatile, but we can adjust it so it's safe for virtually everyone.
Yes.
There are very few people who aren't great candidates. If you've got a spray tan or you use a tanning bed actively, probably not the best treatment for you. But otherwise, almost anyone who walks in the door can benefit from a pico laser, and regardless of your skin tone or type. So I do love that. And the fact that we wiped out your freckles, they can come back with sun exposure, but yeah, we can wipe the slate clean for so many people who have who've spent a few too many hours getting sun kissed. So
I just had freckles. I didn't have like sunspots or anything, but I've treated patients with sunspots, and still seeing them just fall off, disappear is awesome. And I mean, sometimes it takes a couple treatments. It doesn't always come off in one single treatment like it did for me, but I've seen the results from it. And that's another thing is like, I've done laser hair removal. I know it works. Like because a lot of times I've had people like, I've got laser hair removal in the past, it didn't work. I'm like, well, I've done this on my armpits and I can tell you it works. So I like trying the treatments to be able to speak on them more. I mean, I can't try every single treatment,
sure.
But
and some things aren't for you. Like obviously we're not going to have you do, like on the wellness side of things, I'm not going to like pump you full of peptides and be like, here, go talk about them. So if something's appropriate for your plan of care, of course I'll prescribe it for you. And vice versa with the lasers. Like you don't need to do a fully ablative CO2 resurfacing. You've got young, healthy, beautiful skin, but maybe a pico laser, maybe a cool CO2 to address some light texturing. And you've experienced that. You've experienced microneedling. So you can speak to the aftercare and to the results and set realistic expectations. And that's so important as an aesthetic practitioner for sure.
Yeah, I definitely feel like once I get it done, it's way easier to talk about.
Oh, 100%. Yeah. Otherwise, you're just reading off of a piece of paper. And if somebody's like deviates with a question.
Yeah.
How do I reply to that? So
like after the tattoo removal, I remember people, be like, does it hurt as bad as getting a tattoo? I'm like, yes, but it's way quicker.
yes.
10 seconds.
Yeah. Yeah. It definitely, it takes longer to get a tattoo than it does as far as like per session to get it removed. But the sad part is just the multiple sessions that goes into it. So definitely kids, sidebar, listen to your moms. If you are not truly committed to that ink, do not get it. It is not so comfy to get it removed.
Yeah.
We can lighten it up to help you get a good cover up later in life though. So what do you want to develop as far as aesthetic skills over the next year or so?
So for aesthetic skills, like I said, I'm getting more comfortable with filler, but I've gotten to where I'm able to tailor it to each person. Because when you start training with filler, you don't want to vary too much because you don't want to mess something up until you're comfortable. So once I get comfortable, I start to really tailor it to the patient, and I love doing that. But I just want to get more like precise with filler. I feel like with tox, you can be very precise, but with filler, it's a little more tricky sometimes. But I feel like I finally am comfortable with it. So now it's time to start refining it, if that makes sense.
Absolutely. I know I had told you when you came on board, my goal was after about a year, I wanted to get you into a cadaver lab. And it's been about a year and a half since I've been into a cadaver lab myself. So I'm definitely overdue. I like to do one every year or so. So I think that's going to be our goal professionally this summer is me, you, and Katie get to a cadaver lab. But that is really when you can peel back the layers. I know it sounds morbid for those of you who aren't in healthcare, but when you can peel back the layers of the face and see all the different muscles, the ligaments, the layers of skin and tissue, and you can see where you're injecting, the level of skill that you develop is top tier. So
being able to instantly see the results and instantly correct and see what plane
so
you're
if you've seen something like, oh, I placed it, but it just didn't settle how I wanted it to, maybe you weren't in the right tissue plane. So the cadaver lab is really something that's going to be beneficial in refining your anatomical skills and your assessment skills there. So maybe we can find a conference with a cadaver lab and take a little week vacation somewhere with a beach, hopefully.
Yeah.
All right.
The cold.
So your favorite treatment to receive from the patient side, you said you love a pico laser.
Mm-hmm.
You've had
but probably I have makeup on right now, but my biggest concern is I have a couple scars up here just from, being a kid. But then I also have like acne scars on my cheeks. Like I have like ice pick scars on my cheeks. So my biggest thing is acne scars. I love a pico laser to give other people, but for me, I feel like I would benefit more from microneedling.
So we've got a staff treatment day planned. I think it's February 6th, if I'm not mistaken. What are you hoping to get done on that day?
Probably, haven't really thought about this. Microneedling, if I'm able to, because I would love that. I'm not going to get any tans or anything before then.
You better not be getting a tanning bed.
No, I was thinking I'd get
That's in the employee handbook. Yeah. It's not, but don't.
She's like, it's not listed.
It's an tanning bed. It's an unwritten rule. Do not get in a tanning bed.
No, I've not been in a tanning bed in a couple of years. But probably microneedling and probably a pico laser.
Okay. All right. So we're going to do the pico microneedling protocol.
Yes.
Perfect. So we can expect downtime. Let's talk to the listeners about your last microneedling experience and what the downtime was like.
So for the pico laser, the redness usually lasts like a day or so. But for the microneedling, I felt like the redness lasted a couple more days, and it almost got a little bit darker. Like the redness almost got darker, and my skin got a little bit more rough on day 3. And then right around, I actually had a little bit of peeling, surprisingly. Not really surprisingly, but I just have drier skin. So I had a little bit of peeling on my cheek, and that was more around day 4 or 5.
Yeah. And we've got 2 microneedling devices in clinic. We've got the traditional Exceed microneedling, which is stainless steel tips. And that's what Isabelle used during her last treatment a few months ago. And then we also have the Pixel 8 RF microneedling, which is gold-plated and heated needles. We don't really see peeling with that one. It's about 24 hours of downtime and maybe a little bit of like sandpapery texture. But otherwise, there's no peeling, whereas in the Exceed microneedling, especially over areas where we get a little more aggressive because we're trying to address that texture, you will kind of shed like a mild sunburn. So you're willing to go through that process again. You love the results, and you know the payoff's going to be worth it.
Yeah, and it wasn't necessarily like I wasn't in pain on day 1. Like I wasn't necessarily in pain after the procedure. It just was like
dry, tight.
Yeah, just dry, just a little uncomfortable.
Yeah.
I also did the cool CO2 over top. I did a triple stack last time.
Yeah. Are you going to do the triple stack this time, or are you going to skip the cool CO2?
This cool CO2, I thought that's what gave me the sandpapery skin, but it might have been the microneedling.
The sandpaper probably came from the cool CO2, and then the peeling probably came from the microneedling usually. So if you do the Pixel 8 by itself, you can feel that kind of sandpaper.
Okay.
It just really depends. And with the Pixel 8, it's because you've got 64 pins that are going in at the same time, and they create with each stamp 64 tiny little micro injuries, and you'll get those little bitty scabs, and that feels like sandpaper. Same thing with the cool CO2, depending on the spot size. Usually with the cool CO2, we're using a really, really low energy level, and the spot size is really spread out, whereas with the fully ablative setting, we're just burning it all off. So you do not
need a fully
you do not
ablative.
need that. That is for somebody who's got a lot of textural concerns, lots of deeply etched in lines. You do not need that. And as long as you work here and keep up with your treatments and your professional skincare, you're never going to need that. So, as far as what you're looking forward to over the next year with your treatment plan and your own personal skin health, what are your goals?
My goals, well, I've had pretty bad, bad for me, acne breakouts on my cheeks recently. It's finally clearing up because late December, I kind of just stopped eating a ton of dairy. I used to eat cheese every day. I used to drink, milk every day. So now I switched to almond milk. I don't use nearly as much dairy, and my acne has cleared up.
So you found a trigger.
So I'm a little sad because I do love dairy, but I've been cutting back, and it's helped a lot. So definitely helping, because my acne was a big thing, and then I have acne scars just from because I'm a picker. I've picked my cheeks for years. So for my skincare journey, I definitely would like to treat my acne scars. That's why I really like the microneedling and the pico laser, and the cool CO2 can help with that too. That's what I hit my skin with last time, and I want to say probably 25% reduction in my acne scars. So
I was going to say it may take more treatments with the mild settings, but especially if you are somebody who is constantly public facing, needs to go back to work, doesn't really want a lot of open wounds, especially not so much now, I guess, working in the PACU, but when you were working in the ICU, you did not want to go to work with any open wounds.
You never
and
know what's
contract a
going to
super
happen.
bug, especially on your face. So PACU, not that you're not still being exposed to potential pathogens, but it's a little less risky. So, and I mean, not everybody needs an aggressive treatment, nor do they have the downtime or the pain tolerance for it. Well, we do have some oral sedation and anxiolytics available in office to help people tolerate procedures. With the milder treatments, you just don't need it. They're so quick. We use topical numbing, prescription strength numbing cream. So virtually everybody can tolerate it. Between the topical numbing and our Zimmer chiller, it is a godsend.
Yeah, I feel like I have a fairly high, decent pain tolerance, but also my skin can take a lot. I don't have super sensitive skin, so that's why I'm okay doing a triple stack,
You don't have highly reactive skin. So
I know some people, you flick their cheek and they have a welt. So my skin is not like that. My skin it can take a beating. So
we're not going to go too hard on it. So what are you doing at home as far as home care routines? Do you have a certain product line, or a specific product that you feel like is a non-negotiable, something that you absolutely love, like to restock constantly?
Yes, well, I just restocked on my Tone Smart SPF. I love that stuff. I don't have it on today, but I usually do. Whenever I'm not wearing a foundation, I usually use my Tone Smart. I love that. For cleansers, I go back and forth. I don't have a set cleanser right now. I kind of flip back and forth between the La Roche-Posay one.
Okay.
They have it at Target, CVS. It's more affordable option, but I've used that for a couple years. I feel like it's just good. I keep my acne at bay, but I also really love the Epicurious oil cleanser. I like that for removing makeup and double cleansing with.
I love a good oil cleanser for anybody who wears SPF or makeup, whether it's Epicurious or another brand that you like. The big thing is just finding one that is good with your skin type. There's never any shade from me towards using over-the-counter products. I can't really speak to a line that I haven't personally used or prescribed, obviously, but as long as you don't feel dry, tight, you're not stripping your skin barrier, that is the cleanser for you. If it's causing any reactions or stripping your skin barrier, if it is so stripping that you feel dry and tight, or your products that you put on after is stinging, then that is something that you need to come speak with us about, one of our nurses or our estheticians, so we can target what is causing that barrier concern and we can swap out a couple products for you.
I will say, usually in the winter, my skin is like so dry, flaky, crusty, and the Epicurious lipid serum has I haven't had any issues with that.
Yeah.
Like this year, because that stuff it's like liquid gold.
It really is.
I absolutely love it.
It's anti-inflammatory. That's why we use it.
I've talked about that product since I've started.
We use it in all of our post-procedure kits. So it's a non-negotiable if you're getting, a pico laser, or if you're getting some sort of microneedling or a CO2 or an erbium laser. Using that is what helps with that dryness, that tightness. It helps cut down your healing time. And even taking a look, because we'll put on a face mask when we ablate the skin or break the skin with microneedling, and looking at the face versus the neck that doesn't get a mask, you can see a clear line of demarcation of the reduction in that erythema or that redness. So that stuff is top tier. Thank you, Epicurious. I will never be without you.
It also helps cool the skin down too.
Absolutely. I think the clinical paper that they had published, it was like it cooled the skin by 1 degree. So
yeah,
I absolutely love that. Whether you use the serum or if you're a mask girl, you like to do a mask a couple times a week, they have the post-procedure mask, but we also sell them on the retail side too. So in 5-packs. All right. Well, is there anything else that you want to share with our listeners, with our patients, with your friends or family who are listening to you today?
Thank you all for listening, and thank you for anybody that has supported my journey, come see me as a patient, shared my posts, or just following from afar. It doesn't go unnoticed. I remember starting here and, being nervous putting myself out there, because when you are in the ICU, patients come to you. You don't have to, sell yourself. Here, you have to kind of put yourself out there and, get to know people, meet people. And the overwhelming support that I've had since I've started has been amazing. I had, you always get fears. What if people don't support me? What if I can't get clients booked? But I feel like the support I've had, and I'm just so thankful for it. I mean, I've been in this position for going almost a year, about 9 months now, and the support has just been amazing.
Yeah. And we appreciate all of the patients that had been with me for years who were willing to step up and be models for Isabelle.
Yes.
Yeah. And then the new patients that came in that saw her on social media. Some were friends and family, but a lot were strangers too that just really, they connected with her videos. They were excited to be a model. They were willing to donate their face to the science at Luxe Lift and to share their before and afters on social media. So that's always appreciated. It's really hard to commit to an aesthetic provider this day and age if you can't see what other patients have experienced. So, and that's difficult as somebody new. And I always like to say, I'm an entrepreneur. I created a business. And then the people that I hired, they have to be intrapreneurs. They have to still have that entrepreneurial spirit, and they have to be willing to help build their brand, their own personal brand, while also aligning with the clinic's brand in order to succeed and help get their books filled. So Isabelle's done a phenomenal job of that. Everybody who's been in her chair has adored her. I've never heard a negative thing about her.
And also just thank you, Bobbi. I mean, you took me under your wing. You've quite literally taught me almost everything I know about aesthetics, and you believed in me and you saw potential in me, and I cannot thank you enough for that, because really it's changed my life.
Like I said, I couldn't have handpicked a better person from the day that you came in from the interview. As soon as I saw your email resume, I knew that name, and I went back and looked. I was like, oh, that was her. So I was excited to see
I didn't know if you'd remember me.
Oh yeah, I remembered you, and I remembered you were a nursing student. So I was excited to learn a little more about you because I was impressed by your resume, and I was looking to see I only had that one instance where I met you. Not that you were immature, but I was looking to see how you had matured and shaped into a young woman. And again, we were all impressed with you. As soon as you left, everybody was like, we need to hire her. Without a doubt, by the end of that shadow weekend, I knew I was ready to extend that offer and bring you on board. I'm so glad I did. And I hope you're with me for several years to come. So.
I plan on it. Yeah. I plan on it.
All right. I hope that this episode has been a great insight as to who Isabelle is as not just an injector, but as a person. If you want to follow her story, she is on Instagram at Izzy the Injector _Luxe Lift. And then she is also over on Facebook, same name, right? Izzy the Injector at Luxe Lift. And then she's on TikTok as well. She shares more personal and professional things there. And correct me if I'm wrong, it's Izzy Snappy Kathy?
Izzy Kathy Snappy.
My name's
Isabelle Catherine Snapp.
Okay.
So it's just Izzy Kathy Snapp.
I'll make sure I'll correct that for the subtitles, and then I'll link it up in the show notes. And of course, you can follow me, Bobbi, the NP _Luxe Lift over on Instagram and TikTok, and then at Aesthetically Awkward Podcast on Instagram. All right, guys, we'll go ahead and let you go, and we'll see you next week on the next episode. Thanks for tuning in.
Thank you.